On this edition of Best Docs Network featuring Forest Park Medical Center, we'll meet ENT Dr. Timothy Trone, plastic surgeon Dr. Ricardo Meade, ENT and facial plastic surgeon Dr. Colin Pero, bariatric surgeon Dr. Daryl Stewart. Good morning, everyone. I'm Candace Kruger along with Jim Knox, and we're back once again with another edition of the Best Docs Network featuring Forest Park Medical Center, one of the best medical centers in all of the Dallas-Fort Worth area.
One of the best medical centers, of course, with some of the best doctors in the Dallas-Fort Worth area operating right here out of Forest Park Medical Center. And now it's time for our first doctor, and with more on that, let's join Kelsey Reich. Kelsey?
Thanks, Jim. Our first physician, Dr. Colin Pero, who operates right here out of Forest Park Medical Center, is unique in that he is a board-certified ENT as well as a board-certified facial plastic surgeon.
Before I came to see Dr. Pero, I was suffering with chronic sinus infections and congestion and facial pressure, pain. So my family doctor had referred me to him to correct these issues.
When a patient comes in and complains of not being able to breathe, you have to address it in two different manners. The first is, do they have a functional problem? Is there something that is going wrong with how the nose is supposed to function? And the second one being, is there an architectural problem? Is there physically something in the way that needs to be corrected in order to improve the problem?
After Dr. Pero examined me, he ordered some imaging studies, and this showed that I had a deviated septum.
So when Ann first came in to see me, we talked primarily about the function of her nose. She had a pretty severe deviated septum to one side that was clearly blocking not only her airflow, but was also contributing to some recurring sinus problems that she had. And so ultimately we discussed correcting the deviated septum to correct not only the airflow through her nose, but also to help her with her sinus problems. At the same time, she had concerns about the external appearance of her nose, and so we addressed performing those at the same time, which for a number of reasons is not only easier, but technically beneficial to do at the same time.
Along with the surgical procedure for the repair of my deviated septum, I inquired if Dr. Pero could repair a small bump that I had on my nose. All of my family has it on my mom's side. I've always been extremely bothered by this bump, and he said sure, it would be a very simple thing to do, and I'm very pleased with the results.
So ultimately we did that. We addressed not only the outside shape of her nose while also addressing the inside of her nose. We were not only to improve her nasal airflow, but also correct her chronic sinus problems as well.
I'm forever grateful to Dr. Pero for fixing those issues and getting rid of the bump, helping with my self-esteem and loving my look a lot more.
Recovery is well tolerated. Typically we tell patients to expect to be out of work for 3 or 4 days. That could be up to a week in some patients' cases, but it just depends on the patient.
Dr. Pero and his staff, they're very helpful, and this made me feel very comfortable and confident going into the surgery.
Gavin has a bilateral cleft lip and palate, so he was born where the lip and the nose and the roof of the mouth didn't form properly. And because of that, it makes feeding and speech and overall activities of daily living, even for an infant, somewhat difficult.
We found out he had a bilateral cleft lip, and so Matthew started researching. And he found Dr. Jenico. So we met with him before Gavin was born, and he talked us through all the steps and made us feel better about us having a child with a cleft lip and palate.
A cleft lip occurs approximately 1 in 700 live births. The bilateral cleft lip is probably about 1/3 to 1/4 of all cleft lip and palate anomalies. So you probably say maybe 1 in 3,000 live births come out like Gavin. So if you think about how complex we are, and you take a sperm and an egg and you put them together, and at the end of 9 months you've got a beautiful baby. It's amazing a whole host of other things don't happen more often. And so this is just all the cells trying to get where they're supposed to be during that developmental process, and sometimes it just doesn't go properly.
I felt really confident in Dr. Genakova. I was scared. I didn't want my baby to even be put under. It was nerve-wracking. But after the first one, seeing Dr. Genakova right after surgery, letting us ease in our mind, saying everything's okay, seeing the results, the next 2, 3, 4 surgeries that Gavin had, and the results that we saw, it just eased us, and I wasn't afraid to take him into the hospital anymore.
The etiology or the cause of these types of anomalies is somewhat unknown. And we do know that smoking, dietary issues or deficiencies, especially B12 folate deficiencies when you're pregnant, can contribute to it. But really, that lip is formed by 8 weeks of age. And then once the development occurs, it's just about growth.
He's just a great doctor. He just held our hand through the whole process and just was great. I'm so glad we picked him.
If you go to the website, you can see all the miraculous surgeries he has done, and I think they just speak for themselves. He's a really pure and genuine guy.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Our next best doctor from Forest Park Medical Center, plastic surgeon Dr. Ricardo Meade, has helped one patient get her youthful look back.
The cheek and brow lift surgery is a method to reposition your eyebrows and maybe soften the wrinkles and creases around your eyes and around the forehead. Those are typically one of the early stages of visible aging to patients. Repositioning the anatomy sometimes will really smooth things out.
Well, I'm going to be 67 next month, and I was getting heavy-lidded, and I needed my eyes lifted a little for vision, if nothing else. But of course, he also did a cheek lift, and very pleased.
In Laura's case, what I did was the eyelids and her brow and cheek, and often we'll restore volume into the cheeks by injecting fat. And so I harvested some fat from her tummy, and we inject some of her own fat, so it's a nice natural result, and it just plumps up the cheek a little bit more, because as time goes by, the cheeks lose their volume.
Dr. Meade had suggested the brow lift instead of the eyelid lift, and he was very right, because I got the results that I really wanted.
It's almost like you're working on daylight savings time. You've backed the clock up, but it just sort of stays there. So will you continue aging? Of course. Would you need a touch-up? Sure. If you wait 10, 15 years, you'll still age 10 to 15 years, but you've backed up the clock that much.
The recovery was very easy, very little swelling, and the incisions were very hidden, and the swelling went down very quickly, and so did the bruising.
It's a real subtle but very nice clean improvement. It just makes you look refreshed. I love the surgery because after a couple of days the patients are smiling, they're glowing, they're just so happy. They're always very surprised at how easy the recovery was when I used the camera to do the cheek and brow lift.
Okay, after the procedure I feel so good and feel good about myself. And I'm a teacher. I am in front of the kids all the time, and it just gives you a lot of self-confidence.
Forest Park Medical Center prides themselves on being one of the top medical facilities in the Dallas-Fort Worth area. They also pride themselves on being a good neighbor because they are very active in the community.
Well, what we have here today is Trick or Treat at Frisco Square. It's an event that's put on every year by the city of Frisco and Frisco Square, which involves all of the retailers, businesses here at Frisco Square to kind of offer a day of celebration around Halloween. Allows families and their children, both two-legged and four-legged, to come out and trick or treat at the different businesses at Frisco Square. Forest Park Medical Center, this is our first year, our inaugural participation at Trick or Treat at the Square, and we're of course excited to be part of the festivities today not only for the residents and those that come by, but also for our employees. We try to treat this as a celebration of the good work they've done, reward them for making us successful in our first 4 months of operation. It's absolutely imperative that we not only provide a great place for individuals who are seeking care and to be a great hospital, but to be a good community partner and a good neighbor. And that is at the top of the list wherever we go, whether that's here in Frisco or Dallas or the new facilities we have coming online out west in Fort Worth and Southlake. We think not only should we be that good neighbor by providing a good place for employees to work, but also a place that people want to come. They see as participating in all the things going on around them, and they see as really a strong community partner. As we thought it through, we thought not only let's be out here and giving away some candy and welcoming the residents of Frisco, but let's also bring some vendors in, provide some additional elements for our employees to participate in, but it also brings in some money that we can then turn around and give back to the Make-A-Wish Foundation. So we want it to not only be a fun event, but something that gives to charity as well.
Prior to coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
Forest Park Medical Center set themselves apart by being committed to providing their physicians the latest state-of-the-art technology in medicine. As this week we feature the OArm.
This is what's called the Medtronic OArm. It's a combination of traditional fluoroscopy with also a three-dimensional imaging component. Within 26 seconds, it will take 755 high-definition images. With the OArm, we can actually take shots of the spine in a three-dimensional nature because the spine is a three-dimensional structure. And the value of that to a surgeon is that they can now see the spine in 3 dimensions and truly be able to determine with precise accuracy their placement of the hardware. The device also enables minimally invasive surgery. By more precisely placing the screws, He's going to be able to allow the patient to have a quicker recovery time and hopefully have a better quality of life post-surgery due to the more accurate placement of the hardware which the OArm enables. We have the OArm itself, which collects the images. We have the viewing cart, which the images are reconstructed on. And then we also have the Stealth Navigation Image-Guided Surgery Unit. After the images are recreated on the Spinal Navigation Unit, the surgeon is able to bring different surgical instruments into the field that will help him more effectively place the instrumentation into the patient's back in a three-dimensional nature. Because this device is used intraoperatively, the surgeon can use the image-guided surgery unit to do the remainder of the case without additional radiation being delivered to the patient. The benefit of that is to the patient that they will potentially not need to be sent for a post-operative CT to check the final placement of their hardware, since they're able to do that real time in the operating room.
Don't forget, for more information on Forest Park Medical Center and of course all the outstanding doctors that operate out of Forest Park Medical Center, log on to thebestdocsnetwork.com and click on Forest Park. Candace?
That's right, and now we're going to check in with Kelsey Reich, who has more information on our next Forest Park doctor.
Thanks, Candace. Our next Forest Park Medical Center physician, bariatric surgeon Dr. Daryl Stewart, was able to help one individual get his life back by helping him lose weight.
I was 342 pounds at my largest weight and was diabetic on insulin before my surgical procedure, the duodenal switch. I also had high blood pressure, high cholesterol, and obstructive sleep apnea. I was on, at my peak, 9 medications.
The duodenal switch is a sleeve gastrectomy in which you remove about approximately 2/3 or a little bit more of the stomach, but you, instead of removing it in a horizontal plane and removing the valve at the bottom of the stomach, you make the staple line in a vertical plane, maintaining the valve at the bottom of the stomach, and then you divide the small intestine, which is the duodenum, just below that valve, and that's where the term duodenal switch comes from. You basically divide the duodenum and switch in the ileum, which is a lower part of the small intestine.
I was at a point in my life where I was well over 100 pounds overweight, and so statistically speaking, diet and exercise, less than 5% success rate. And so I knew for me, it would take a surgical procedure to lose the weight permanently.
And he's just had really good results. He's also become a great advocate of the surgery. After I did his surgery and after he started losing weight, I started getting a steady stream of his patients coming to see me. And of course, they were all very well informed because he taught them about it ahead of time and everything.
Lost my diabetes within a few weeks, stopped all my medications the day after surgery, and within 6-7 months had lost the majority of all of my weight. By 9 months I had stabilized pretty much and reached a low, I started at 342 maximum, reached a low of 159, I've leveled at 170 and stayed there for over 2 years now with no problems.
My approach to all patients is to try to educate them, first of all, about the different surgery options. And of course, duodenal switch would be one of those options.
In the last almost 3 years, I think we've had over 40 people come to his practice specifically looking for a duodenal switch. Just having seen the results in me, seeing the results in my patients and their family and friends.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com.
About 10 years ago, I was having a lot of shoulder pain, and I had seen several doctors prior to that. And they told me that I had a problem at C6, C7. And I was looking at surgery and a possible spinal fusion. So I called my friend who works in critical care and I said, who's the best neurosurgeon out there? And she gave me Jeffrey Caterini's name. So I went to him. He said, your symptoms don't fit your MRI. Your MRI is wrong. And I had seen 4 previous physicians prior to that, and Dr. Caterini is the one that caught it. I get emotional.
One of the procedures we offer here in the practice is insertion of a cervical artificial disc. We see patients aged 20 to 55 who have a soft tissue disc herniation or one-level disc disease. They typically present with one-sided neck pain and arm pain.
He came and sat right down next to me and he showed me the artificial disc and the way it worked and the way he would screw it in. And I said, you know what, that's a metal disc, ball and joint. That makes sense to me. You know, I didn't like the idea of pulling bone out of my joint or out of my hip and then fusing my neck, and I have limited range of motion. That just didn't make sense.
The good thing about the artificial disc is not restricting movement, it's keeping movement. And there's no need for a cervical collar post-op, or there's no need for a bone growth stimulator post-op because you do not want to promote a fusion.
And I woke up from surgery, the pain that I had had for over a year was gone. And I just bawled. So right after the surgery, I was out there playing tennis immediately with absolutely no pain. Best decision of my life.
Nancy did great post-op. She returned to her activities. She's actually referred friends from out of state for the artificial disc, and she's very happy with the result, and she's got great range of motion.
Go to a neurosurgeon. They're meticulous, and especially go to Dr. Jeffrey Caterini because he's outstanding.
There are a number of people that suffer from sleep apnea, and our next Forest Park doctor, Dr. Timothy Trone, has helped one individual change his life.
Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she'd say, because you'd be breathing real heavy, and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform, and that was performed on Mr. New, is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just you wake up, you're just refreshed because you have, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat because now that passage is open. And it was just a totally different feel than you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess with it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
You're in the great city of Southlake, and behind me you're seeing us in development of our Forest Park Medical Center at Southlake, our latest and greatest iteration of Forest Park Medical Center. Our Southlake facility is a 54-bed hospital, 12 OR, 6-bed ICU facility. It's approximately 150,000 square feet. We know now that this is the production model, if you will, for the Forest Park chassis. And we are approximately, call it 60% complete. This has a completely different feel than all of our other facilities thus far, and it should. It needs to be a representation of the community. When we're choosing our location, Southlake fit really perfectly with where the physicians are wanting to be. This particular location, our real estate strategy is consistent wherever we go, and that's great visibility, great access, and really kind of showcasing the type of care that the physicians will deliver here at Forest Park Medical Center. So here off of 114 and White's Chapel is a premier location from a real estate standpoint to really, again, showcase the physicians. We consistently try to have a hospitality-like feel in every one of our hospitals. Now, you hear many people talk about implementing the hospitality aspect into hospital, but few actually pull that off. And we believe that we kind of take that extra step, if you will, in implementation on connecting those dots. Once we're complete, you'll see water features, exterior and interior. It's one of the calming aspects that is a mainstay for Forest Park Medical Center. You'll see a grand clock tower that's out here, which is something new for us, but it's a nice feature. The one thing consistent about Forest Park is that we're changing and we're evolving. I mean, it's truly amazing.
I had back pain, I had neck and shoulder pain, and my breasts were large, and it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain, and it would help for a while. And then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she's been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angelbaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her axillary tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her, and she felt it immediately.
I'm looking forward to the fashion options that I'll have now, and just looking proportioned, no more pain. I'm just really excited.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring Forest Park Medical Center and many of their amazing doctors that have helped change people's lives.
That's right. For more information on Forest Park Medical Center, as well as the doctors, head to the website, bestdocsnetwork.com, and click on Forest Park.
That's right. And as always, if you have a question or comment for us, we would sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
That'll do it. See you next week.